Hello everyone, my name is Mary Kavisha and I'm presenting my capstone in occupational therapy-led pelvic floor program for adults in resource-limited community. Um, Pelvic floor dysfunction is a prevalent, often undiagnosed condition which significantly affects occupational performance, health management, and quality of life, particularly among older adults. It is more prevalent in women and people of low socioeconomic status or limited resources who often experience more severe symptoms and are less likely to seek care. Pelvic floor dysfunction disrupts daily activities such as toileting, sleep, social engagement, because it contributes to embarrassment, reduced confidence, and social isolation. In resource-limited communities, there are different barriers, including limited access to a provider, low awareness of education, transportation, and childcare, and often stigma and discomfort. The purpose of this capstone was to develop an occupational therapy-led pelvic floor health program for adults 55 age and older in a limited resource community and the potential impact on occupational performance, satisfaction, and self-efficacy. The theoretical framework used were model of human occupation and behavioral frame of references, because with model of occupational MOHO, you are looking into the volition, which affect willingness to engage in pelvic health behavior, habituation, what are your daily toileting routine and self-care, performance capacity, physical and cognitive task performance and their limitation, environment, social, physical, and cultural. Then when you incorporate it with behavioral frame of references, it helps with goal setting, identify desired behaviors, and set achievable goals. Reinforcement, rewards, and positive feedback, which will strengthen the desired behavior. Self-monitoring, data collection, and tracking to increase awareness, habit formation, repetition, and reinforcement to promote long-term change. Need assessment. The target population for this project was adults 55 plus residing in the government subsidized housing in Loganville, Georgia. There were some barriers, and barriers that were identified were reduced access to care, transportation, limitations, low health literacy, stigma, limited awareness, and lack of structured pelvic health education. What was identified as need were accessible, culturally relevant, and low-cost pelvic health education and self-management and support. So this project was a 4-week consisting of structured education workshop, low literacy printed material, guided self-management strategies. Content included education on pelvic anatomy, bladder training, toileting routine, and lifestyle modification, how to integrate that in daily life. This program was designed to be low cost and sustainable with occupational therapists facilitating education, habit formation, and environment adaptation. Methods we use are projected to use symptom severity and quality of life, questioning occupational participation performance, and self-efficacy. The projected outcome, a sample of 20 dwelling adults was projected for the program. Improvement to anticipated in occupational performance, satisfaction, and self-efficacy following the 4-week program. And I have the graph showing the projection pre and post, with both showing significant projected changes. The proposed program is expected to produce statistically significant improvement in occupational performance, satisfaction, and self-efficacy. Large effect size suggests substantial practical significance in promoting self-management, function independence, and participation. However, implementation is needed to determine the actual effectiveness of this program. Thank you.